Hi guys, this is our Sublocade Part 2 video because our Sublocade video was probably one of our most popular videos and lots of questions came out of it. Sublocade is the once a month injection of Suboxone. I wasn't super psyched about that. Some people are having different experiences with it, and since that initial video came out, I wanted to provide an update. The first update is certainly easier to get. When the medicine came out, there was a long application process. It took weeks and weeks and weeks to get it. Now we can apply easily and we get the medicine easily. It's covered by private insurance. Here in California, it's covered by our state program. So that's good. The other concern I had was tapering. It's like, how would you come off this medicine? So lots of viewers and people have given us input. We've adopted some new strategies, so I thought I'd take a second to tell you about them because they're pretty interesting. So Sublocade starts at a high dose, 300 milligrams a month for 2 months. It steps down to 100 milligrams a month. And don't forget, that's still equivalent to well over 16 milligrams a day. But then the question is, well, how do you taper off this long-acting medicine that we know once you've had 4 or 5 doses, it's in your system for a year? Well, that 100 milligram dose comes in half a mil. Not much, okay? But what we have started to do was take that 0.5 mil and drop it down to 0.45 or 0.4, right? That's a 10 or 20% reduction. So every month we're given the shot, we can actually decrease the amount of medicine by 10 or 20%. And because of that very long duration of action, it's actually a very tolerable slow taper. So I do think that there's an option now to use Sublocade in a tapering program. The other part of that's probably extending out the doses from 4 weeks to 6 or 8 weeks, depending on how long it lasts. And don't forget, this is all off-label. This is thinking outside the box. You absolutely need to talk to your provider about this. But we deal with all sorts of interesting things here and try to make it work for people. So I think those are the big updates. The other thing is that there are some site reactions. In other words, when you get that shot, it leaves a little eraser-sized bump under the skin. That doesn't seem to go away very quickly. I've had patients, and I'll show you a picture of, we can see the last 4 or 5 months, every shot they've had. Other than that, I think it's going pretty well. People are happy with it. Some people like not dealing with the taste and the medicine every single day. And again, now that there's a strategy for tapering, it's probably worth trying. I think when you get into these ultra low doses, like the half a milligram, the 0.25, I'm not sure where that's going to be, but maybe we'll know here in the future. We'll update it as we go. So I'm not really up or down on Sublocade, but you can decide whether it's for you or not. It certainly seems to be working well for people who have challenges with the oral medicine. Hopefully that's been good information for you. So please share our videos and links so to get the word out. People need treatment. People need to know these medicines are out there. A lot of people live in places where this isn't general information, so please share it. And please subscribe so you don't miss anything we're talking about. And then give us some feedback, things you want to hear about, things you want to get more information about. We're happy to direct some videos out there on certain topics that you want more information on. Again, thanks for listening. Please share, please subscribe. Thank you.